Section 17. True and false. 1. Defecation or bowel elimination is the passing of feces from the large intestine out of the body through the anus. The answer is true. 2. Feces is also called stool or bowel movement. The answer is true. 3. Stool is normally black, hard, and formed in a tubular shape. The answer is false. 4. Certain foods can change the color of stool. The answer is true. 5. Liquid stool should be reported to the nurse. The answer is true. 6. As a person ages, peristalsis increase. The answer is true. 7. Raw fruits and vegetables are high in fiber, which helps with bowel movement. The answer is false. 8. Constipation is the ability to eliminate urine. The answer is false. Fill in the blank. BRAT. Colitis. Malabsorption. Harris flush. Weakening. Peptic ulcers. 120 milliliters. Blood. Worms and amoebas. Occult. Colon cancer. Enema. Fecal impaction. Hemorrhoids. Diarrhea. Flatus or gas. Lactose intolerance. 9. A specific amount of water with or without an additive that is introduced into the colon to eliminate stool is blank. The answer is enema. 10. A blank blank is a hard stool that is stuck in the rectum and cannot be expelled. The answer is fecal impaction. 11. Blank are enlarged veins in the rectum that may also be visible outside the anus. The answer is hemorrhoids. 12. Frequent elimination of liquid or semi-liquid feces is called blank. The answer is diarrhea. 13. Flatulence is also called blank or blank. The answer is flatus or gas. 14. The inability to digest lactose, a type of sugar found in milk and other dairy products, is called blank. The answer is lactose intolerance. 15. A diet of bananas, rice, apples, and tea, toast is also called blank diet. The answer is BRAT. 16. Irritable bowel movement syndrome, which is a chronic form of stomach upset that gets worse from stress, is blank. The answer is colitis. 17. Blank means that the body cannot absorb or digest a particular nutrient properly. The answer is malabsorption. 18. A return flow enema, also called a blank, may be ordered to expel the flatus. The answer is Harris flush. 19. Heartburn is the result of a blank of the sphincter muscle which joins the esophagus and the stomach. The answer is weakening. 20. Blank are raw sores in the stomach or the small intestine. The answer is peptic ulcers. 21. Colorectal cancer, also known as blank, is cancer of the gastrointestinal tract. The answer is colon cancer. 22. A commercially prepared enema usually has blank solution and may have additives. The answer is 120 milliliters. 23. Stool specimens are collected so that the stool can be tested for blank. The answer is blood. 24. Blank and blank can be detected with an ova and parasites test. The answer is worms and amoebas. 25. Blank means something that is hidden or difficult to see or observe. The answer is occult. Section 18. Fill in the blank. Vaginitis, Sarcoptes scabii, hyperthyroidism, myocardial infarction, angina pectoris, atherosclerosis, glaucoma, safe, spinal cord, impairments, circulation, Parkinson, right, CVA, complementary medicine, amputation, muscular dystrophy, MD, closed, women, autoimmune illness, ringworm, itching, inflammation, wound, shingles. 1. Scabies is a skin condition caused by a tiny mite called blank. The answer is Sarcoptes scabii. 2. Blank is also called herpes zoster. The answer is shingles. 3. A blank is a type of injury to the skin. The answer is wound. 14. Dermatitis is a general term that refers to blank or swelling of the skin. The answer is inflammation. 5. Early signs of stasis dermatitis include rash, a scaly red area, and blank. The answer is itching. 6. Blank is a fungal infection that causes red ring-like patches to appear on the upper body, hands, and feet. The answer is ringworm. 7. Arthritis may be the result of aging, injury, or in blank. The answer is autoimmune illness. 8. Osteoporosis is more common in blank after menopause. The answer is women. 9. A blank fracture is a broken bone that does not break the skin. The answer is closed. 10. Blank refers to several progressive diseases that cause a variety of physical disabilities due to muscle weakness. The answer is muscular dystrophy, MD. 11. What is the removal of some or all of a body part, usually a foot, hand, arm, or leg? The answer is amputation. 12. Treatments that are common in addition to the conventional treatments prescribed by a doctor is referred to as blank. The answer is complementary medicine. 13. Blank or stroke is caused when the blood supply to the brain is cut off suddenly by a clot or a ruptured blood vessel. The answer is CVA. 14. Weaknesses on the blank side show that the left side of the brain was affected. The answer is right. 15. A person with blank disease may have a mask-like facial expression. The answer is Parkinson. 16. Range of motion exercises help prevent contractures, strengthen muscles, and increase blank. The answer is circulation. 17. Multiple sclerosis is an unpredictable disease that causes varying symptoms and blank. The answer is impairments. 18. People with blank injury may have paraplegia or loss of function of lower body and legs. The answer is spinal cord. 19. During a seizure, the main goal of the caregiver is to make sure that the resident is blank. The answer is safe. 20. Blank is a disease that causes the pressure in the eye to increase. The answer is glaucoma. 21. Hypertension is caused by blank or hardening and narrowing of the blood vessels. The answer is atherosclerosis. 22. medical term for chest pain is blank. The answer is angina pectoris. 23. The medical term for heart attack is blank. The answer is myocardial infarction. 24. When the thyroid produces too much thyroid hormone, the cells burn too much food. This is called blank. The answer is hyperthyroidism. 25. Blank is an infection of the vagina. The answer is vaginitis. Section 19. Match to the correct answer. 1. Cognition. The answer is F. Ability to think logically and quickly. 2. Confusion. The answer is I. Inability to think clearly. 3. Delirium. The answer is G. State of severe confusion. 4. Dementia. The answer is H. Serious loss of mental abilities. 5. Progressive. The answer is E. Disease is advanced. 6. Degenerative. The answer is D. Disease gets worse. 7. Onset. The answer is B. The time of signs and symptoms. 8. Irreversible. The answer is C. Disease or condition that cannot be cured. 9. Alzheimer's disease. The answer is A. A progressive, degenerative, and irreversible disease. 10. In this stage of Alzheimer's, the resident would be disoriented to time. A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. The answer is A. 11. Which of the following is included in Stage 2 Alzheimer's? A. Temper tantrums. B. Incontinence. C. Inability to read, write, or do math. D. All of the above. The answer is D. 12. Which of the following is not included in Stage 3 Alzheimer's? A. Difficulty swallowing. B. Mood swings. C. Inability to recognize family or self. D. Increased sleep disturbances. The answer is B. 13. People with Alzheimer's disease will not show all the symptoms at the same time. A. True. B. False. C. None of the above. D. C only. The answer is true. 14. When residents say the same words, phrases, or questions over and over, this is called blank. A. Reservation. B. Preservation. C. Presumption. D. Repetition. The answer is B. 15. Which of the following words means a way to change an action or development? A. Determination. B. Intervention. C. Reservation. D. Prevention. The answer is B. 16. A resident who is excited, restless, or troubled is said to be blank. A. Triggers. B. Sundowning. C. Agitated. D. None of the above. The answer is C. 17. When a person gets restless and agitated in the late afternoon, evening, or night, it is called A. Triggers. B. Sundowning. C. Agitated. D. None of the above. The answer is B. 18. When a person with Alzheimer's disease overreacts to something in an unreasonable way, it is called A. Sunsetting. B. Sundowning. C. Violent behavior. D. Catastrophic reaction. The answer is D. 19. A resident attacks, hits, or threatens someone is blank. A. Disruptive. B. Violent. C. Alzheimer's. D. Dementic. The answer is B. 20. Walking back and forth in the same area is called A. Pacing. B. Wandering. C. Sundowning. D. None of the above. The answer is A. 21. A resident who sees things that are not there is having blank. A. Hallucinations. B. Depression. C. Delusions. D. None of the above. The answer is A. 22. A resident who believes things in a physical disease he has that is not there is suffering from blank. A. Hallucinations. B. Depression. C. Hypochondriac delusion. D. None of the above. The answer is C. 23. Blank is taking things that belong to someone else. A. Sundowning. B. Catastrophic reaction. C. Hoarding. D. Pillaging. The answer is D. 24. Collecting and putting things away in a guarded way is known as A. Pillaging. B. Validating. C. Hoarding. D. All of the above. The answer is C. 25. Validating means A. Taking things of value. B. Touching others. C. Putting a stamp on everything. D. Giving value to or approving. The answer is D. Section 20. Match. 1. Mental health. The answer is V. Normal functioning of emotional and intellectual abilities. 2. Mental illness. The answer is U. A disease. 3. Fallacy. The answer is T. False belief. 4. Denial. The answer is S. Completely rejecting the thought or feeling. 5. Projection. The answer is R. My teacher hates me. 6. Displacement. The answer is Q. Transferring a strong negative feeling to a safer situation. 7. Rationalization. The answer is P. Everybody does it. 8. Repression. The answer is O. Not remembering sexual abuse. 9. Regression. The answer is N. Going back to an old immature behavior. 10. Anxiety. The answer is M. Uneasiness or fear. 11. Phobias. The answer is K. Intense form of anxiety. 12. Claustrophobia. The answer is L. The fear of being in confined space. 13. Panic disorder. The answer is H. A person is terrified for no known reason. 14. Obsessive compulsive. The answer is F. behavior a person uses to cope with anxiety. 15. Post-traumatic stress. The answer is E. Anxiety caused by a traumatic experience. 16. Apathy. The answer is D. Lack of interest in activities. 17. Schizophrenia. The answer is J. A brain disorder that affects a person's ability to think. 18. Major depression. The answer is I. May cause a person to lose interest in everything. 19. Manic depression. The answer is G. Causes a person to swing from deep depression to extreme activity. 20. Paranoid schizophrenia. The answer is C. Form of disease that centers mainly on hallucinations and delusions. 21. Psychotherapy. The answer is B. A method of treating mental illness. 22. Substance abuse. The answer is A. Repeated use of legal or illegal drugs. 23. Social interaction can promote mental and physical health. A. True. B. False. C. None of the above. The answer is true. 24. Common symptoms of anxiety include which of the following? A. Muscle aches. B. Dry mouth. C. Shakiness. D. All of the above. The answer is D. 25. Which of the following is not a common symptom of schizophrenia? A. Lack of energy. B. Irritability. C. Little or no interest in surroundings. The answer is B.